Hello, everybody. Welcome to tonight's talk. We're going to talk about COVID as well, but its impact on mothers, pregnant women, families, kids. And so we're just going to talk about how that's going on today. I'm going to be one of the co-presenters tonight. We have Dr. Angela Earhart. She's joining. She's a deaf OBGYN physician in Texas. We're thrilled that she's able to be here, and we thank you so much for your time.
Thank you.
So we're going to talk a little bit more about if you're, pregnant women and how they can be safe during COVID, making decisions, and planning to keep your family safe and keep yourself safe during pregnancy. Nigel Howard will be joining us later this evening. So we're thrilled that he's going to be here as well. He is a professional interpreter from Canada. So again, like he said, he's going to be joining us as soon as he can. But with his experience as a medical interpreter, he's going to clarify some of these concepts so that they're very clear in ASL. I'm a deaf family medicine doctor here in Michigan. So I work with all ages of the family. And as we've all had our world upended by COVID, it's important to figure out how to be safe and make good decisions. So we're going to review a few things tonight with our Deaf Health Talk. So please, thank you for your support. And we're going to talk about some of our collaborators tonight as well. We have some partners with Deaf Health, the Michigan Deaf Health Organization, University of Michigan Department of Family Medicine, and MDisability, which is an organization within Michigan Medicine. We have Interpreter Services Department as well. So we just want to thank everybody for their hard work in making tonight a success. We have CART. We're on Facebook Live. I know sometimes the captions can get cut off if you're viewing this on your phone. So a laptop or a computer is usually better. We'll also have, this is through Zoom captioning as well. We want to thank Kate Miller for being our captionist tonight. The other thing I want to mention related to pregnancy is we do have a deaf maternal health survey. We're trying to investigate the experiences of deaf and hard of hearing mothers. So we'll be sharing a link to that survey in the chat box. We really encourage you to take the time and fill that survey out. For us, we want to learn more about deaf moms and hard of hearing moms and their experiences with health injustice and seeing how we can take the time to make services better for them. So if you can't fill it out yourself and you know a deaf mom or hard of hearing mom, please share that. Because again, we're looking at health injustices, health disparities, and we're trying to figure out how we can improve access and health for deaf moms. So COVID really has upended the family. About 10% of all COVID cases are children. And while their symptoms seem pretty mild, they don't have anything real severe, when they do a nasal swab or a throat culture, they are infected with COVID about 10% of the time. So we really encourage you to kind of take stock of what's going on at home, who you're socializing with, making good decisions about acceptable risks or what environments are really bad risks for your family. We're at about 35 million kids who have already contracted COVID-19. Most of them have recovered just fine. So the question remains, why is it that children seem to have more mild or light symptoms compared to adults? Research has shown, or at least has led us in the direction where there's the ACE2 receptor And because children don't have as many of those as adults do, it seems that for their lungs or their heart or their brain development, right, because of their anatomy, they don't have as many of them. So the way that COVID infiltrates the immune system doesn't cause that same kind of problem for kids. Does that mean that kids will never get sick? No. Matter of fact, about 1% of children who contract the virus have to be hospitalized. So it's still important to make sure that you're doing everything you can to protect your children and avoiding unnecessary risk. But luckily, most children, when they get sick, recover quickly. Only about 200 kids so far have died. Obviously, we want that number to be 0, but compared to the number of adults, which is 560,000 people in the United States alone who have died from COVID-19, 200 is remarkably small, and so we're glad that that number is so low. The other thing is MIS-C, which is a strange term. So within the immune system for kids, what happens is when they contract the virus and their immune system starts to break down and as it's fighting it, about 1 in 50,000 kids develops this MIS-C, MIS-C. And for that, they definitely have to go to the hospital in order to be evaluated to recover. So the way the world is now, parents can feel so overwhelmed with kids having to stay home because schools are closing, working on childcare, not being able to go to work themselves, feeling overwhelmed and isolated because they're only at home. That isolation is really a difficult thing for families to deal with. It's nice to know that some school districts are starting to open, so there's more socialization for our kids again. Once schools are open, though, it's important that they have to follow the 6 feet distance. So the regular classroom seating that we're familiar with is not there anymore. They have to be further apart. And different types where they would socialize, like lunch in the cafeteria, also looks different in terms of seating. Masking, hand washing. They have to increase ventilation within the school building as well. The AC units have to filter and the airflow has to be at a certain percentage. Studies have shown, though, that there is a lower risk of contracting the virus within the educational setting than just in a typical social setting. So it is a little bit of a relief as our kids start going back to school. As a parent, and you're taking the time to consider whether or not it's safe enough for your child to go back to school, also look at who they're around outside of school, whether their grandparents have been in a condition where they're safe enough that if the kid were to get virus from school and bring it home, you don't have vulnerable members of your family. Parents, grandparents, once if they were to get the virus, they can contract it faster and have worse symptoms because children can be a carrier. So if you have anyone in your family who has cancer, going through chemotherapy, who has a compromised immune system, has had an organ transplant, these people are at higher risk, especially of contracting disease to the severity of death. So if the kid gets it at school, brings it home and gives it to one of those family members, that wouldn't be great. So take stock of who is in your family, who has health issues, and make sure that you're confident there before sending your kids back to school. There is still the remote learning options and distant learning. And considering your kids themselves, like when somebody has, going through cancer treatment or has an organ transplant, or say something like sickle cell disease, it's much easier to contract the virus. So it's up to you to weigh the risks, to send them back before there's a vaccine, but making sure that the risks are as low as possible. And some kids also have to find a balance. It can be really isolating. There might be some emotional distress, and remote learning, looking at a computer screen all day through Zoom, is not the same experience. And so a lot of our kids are suffering without having that face-to-face contact, which leads to getting behind in schoolwork and academic success. So it's important to really work hard to identify any of these issues with kids and help them to catch up. So you have to really look at each child and figure out what's the best scenario. There will always be some risks, so you'll have to weigh the pros and cons with each decision. And there's no wrong decision. It's really important that every family feel confident that you are making the right decision for your life, for your family, for your children, and for the other members of your family and their health as well. As we look to summer and even the coming fall, we think about sports or family vacations. Outdoor sports and outdoor vacations you should feel very comfortable with. Sports, though, that are high contact usually require masks to be played. For example, basketball is one that's high risk, high contact. Track and field is much more safe. If you're considering going on vacation, I suggest avoiding amusement parks, avoiding arena, where you're going to watch an event. Just think of more distance and spacing to be more safe. As we think of the fall coming up, there may still be the options of remote learning or going back to in-person school. Some schools also have this alternating schedule where you would go in person on Monday, stay home the next day, while another group of kids goes into school. And so they've sort of split the classroom up like that, and they've rotated. So just consider that there might be some stipulations as kids go back to school in terms of scheduling. But I think that we're going to see most schools still providing both options of remote learning and in-person, distance through Zoom learning rather. And so we'll have to see what that looks like in the fall. I know a lot of parents are looking forward to or seeing if a vaccine is going to be available for their children. Pfizer and Moderna have already started clinical trials to see if there's comparable safety for children as there was for adults. So we'll still look forward to the results of that, but they're at the head of their study right now, where both adults and children are continuing to be part of this study. So as the months go on, we'll have to see what their results show. And plus, we're still looking for FDA approval. Now they're still under emergency authorization, and not sure when exactly that will be available for, or when it will be fully approved by the FDA. Could be the fall, could be even next year. But I know that once that full approval comes in, a lot more people are going to be confident about receiving the vaccination. So I'm going to go ahead and pause and let Dr. Angela Earhart take over. So she's going to talk more about maternal health during pregnancy with some of her patients and how to keep them safe. So Dr. Earhart.
Thank you and good evening.
Thanks for being here.
I'm Angela. My focus is on high-risk pregnancies. So I take care of women who have complicated pregnancies, and I've seen a lot. So there's a lot of questions about COVID and pregnancy that I want to talk about. There are three things. The first thing is the danger of COVID during pregnancy. The second thing is how to protect yourself during pregnancy. And the third thing is I want to address the vaccine, things that have just come out about the safety of the vaccination during pregnancy. So those are the three things I'll focus on. The first thing is why pregnancy and COVID are dangerous together. So we know that pregnant women are more likely to get sick. There's more risk for birth that has to be transferred to the ICU. There's more difficulty in breathing. A lot of times people need to have ventilation support for breathing. We know that pregnancy is a higher risk for dying. So pregnancy itself compromises a woman's immune system. It makes it a little bit different. So the baby, as you're pregnant, the way it affects the lungs is it's not the same as when you're not pregnant. Women tend to get sick more often when they're pregnant, and certainly with COVID. Thankfully, most women who are pregnant, if they contract COVID, usually have mild symptoms and tend to recover just fine and go through the regular process of pregnancy. But we do have some groups of people who are more high risk, older moms. So 35 or above into the 40s, they tend to be more likely to be sicker. African Americans or Latina, people who have diabetes or high blood pressure or heart conditions, or things like asthma or COPD. So there's a lot of different health issues that can cause more serious symptoms during pregnancy. So one thing I really want to point out that I think is really important that we've seen so far, we have not seen any birth defects. Once the baby is born, there doesn't seem to be any relation to a mother having COVID and the virus and that affecting the baby in any negative way. We've also not seen any virus cross through the placenta to the baby. So, of course, the baby and the mom are connected by the umbilical cord and the placenta, and that's connection between the mom and the baby. And that's how the baby gets nutrients. And as we've tested babies, we haven't seen any virus transfer to the baby, which is interesting because you would think through the placenta, it's a barrier and it offers protection for the baby, so it seems to be effective. Also, research has shown that it doesn't seem to affect the time of birth, that once the blood draw is done, it doesn't seem to have transferred the virus to the baby. So it seems to be a balance. There is some protection between the mom and the baby during pregnancy. So how to protect yourself during pregnancy. This is the second thing I want to talk about. So it's very, very important, hand washing, to keep up with that. Do that very often, everywhere you go. Use a mask. And the third thing is make sure that you keep your distance. Try to avoid crowds, big gatherings of people. And once the baby is born, a lot of people, of course, want to come over and visit and see the baby, but don't let that happen yet. It's really better to limit visitors to see the baby. The final thing is, as far as protection goes while you're pregnant, there's some new information about the vaccination. So I wanted to spend most of the time about that. One of the things that's very interesting, there's a study done last year that did not include pregnant women. They were left out of the study. So they were doing men and women with no pregnancy, and they found that was kind of a problem. Well, what do I tell women who are becoming pregnant who want to have the vaccine? They want to know, should I get it? Can I have it? And really, until recently, there was no information. It's been available since December 2020. So we've had maybe 3 or 4 months of tracking. And so women who have gotten vaccinated are usually healthcare providers. And so they gathered information from groups of women who were pregnant or who became pregnant after they got the vaccination. And what we've seen so far is that it looks very promising. It looks like there's good results. It looks like it's been safe so far. The vaccine provides good protection for both the women and the baby. There was just a publication, I think maybe just last week, in the New England Journal of Medicine that published about 35,000 women participated, and they looked at the comparison between women who are pregnant and women who are not pregnant, and looking at the side effects to see if there was any difference between if women who are pregnant had any more serious side effects. And they found that the side effects were similar for both pregnant and non-pregnant women. Of course, side pain for where the injection was, some fever, fatigue, but in general, both groups of women, both pregnant and non-pregnant vaccinated women, had the same side effects. So that was very encouraging because they weren't sure if being pregnant would cause more issues or more side effects. And one thing that I do want to make sure that is understood is the vaccination itself is not a live virus. Sometimes people are worried about that, but it is not a live virus. It's a new kind of technology called mRNA. And so it's not the virus itself. So another study was how effective would that be during pregnancy. So they studied a group of pregnant women who had been vaccinated, and then they looked at something called antibodies. And so those are things that we look at to make sure that you have protection, immunity to a virus. It's almost like an army. You can imagine like the soldiers in an army kind of taking on the virus. And so your body, once you get the vaccination, starts to make these antibodies. So we'll check through a blood draw to see if your body is making the antibodies. And so what we saw is that women who are pregnant had a good response and made antibodies similar to women who are not pregnant. So there was some question about, would it be effective for pregnant women? And we found that it does work. One other thing that was interesting is that research showed they wanted to check the baby, the umbilical cord, and see if the antibodies actually went through the umbilical cord to provide protection for the baby. And they found out, yes, that was true, that the antibodies did travel through the umbilical cord and give protection, immunity protection to the baby. So the mother's antibodies are able to travel through the umbilical cord. And so the baby is born with some of the antibodies. So if the mom wanted to breastfeed in addition to that, research has shown that the mother's milk, they wanted to check and see if there were antibodies that would be transferred in the milk. And they found out that was true. So if you think about it, mom can provide protection during pregnancy if she's vaccinated, and then send the antibodies to the baby. And then even after the baby is born, through breastfeeding, the baby is able to get antibodies in 2 different ways from the mother. So that's very exciting, but this is still early in research. We need to have a lot more research done, larger groups of people that we can study, because we still have some questions about early exposure. So each pregnancy has different trimesters. So different sections, there's 3 different trimesters. So the concern is what happens if an exposure happens in the first trimester compared to if it happens later in the pregnancy. If there's exposure in the first trimester, that's where the baby is really starting to develop. All of the things are forming: the brain, the heart, the lungs, the spine. And so right now, we don't see any relationship with birth defects and the vaccination, but it's still early in the research. So we are collecting a lot more data, and we need to have some more long-term studies to collect the data that we need before we can make a really informed decision on the first trimester exposure. And there's many, many questions about fertility. Can you get pregnant after you get a vaccination? Will the vaccination prevent me from getting pregnant, or will it cause infertility? And no, so far we've seen that women are fine getting pregnant after getting vaccinated. So again, there's more research going on about that. Another question that is asked all the time is, can the vaccination cause a miscarriage to happen? And so far, what we've seen is it seems to be a similar percent of miscarriages, which is about 12%. We haven't seen any increase in that with people who are vaccinated. But again, it's still early on and we need some more information, long-term studies. So to review, we know that pregnant women tend to have a higher risk of illness because of COVID. So we really need to make sure that they are protected, both for themselves and their families. So really consider a vaccination. CDC, there was a news conference, I think on Friday, that said, now they are recommending that pregnant women get the vaccine. So it's really start talking with your doctor and see, because we see so far, we haven't seen any bad or higher risks for women who get the vaccination. So, and it seems to provide protection for both the mom and for the baby.
It's really great. And I know that a lot of people are really concerned, right? The vaccine is such a new technology, but it's been very, very positive, very effective at protecting everybody. There seems to be a lot of benefits. And now, like you're saying, it's protecting the mom, and they can pass that protection on to the baby as well. So I do want to talk a little bit about where we are with the 3 vaccines. I'm sure some people have heard, and it's caused some consternation about the Johnson & Johnson, the Janssen vaccine, which is on hold. It is potential to increase a person's risk of getting blood clots. Tends to be in younger, under the age of 50, in women. But it's a very rare development. I want to stress that. So less than 50 women. So it's like 1 in 80,000 people, roughly, is the risk. So compared to getting the risk of COVID, the risk of getting a clot is so minimal from the vaccine. And only just a little bit less than 1% risk of contracting a problem from the vaccine. You know, and if you think about getting in a car and driving, which is what we do every day, that's a less risk than getting in a serious car accident. So again, all of these things are factors that you have to consider whether or not the vaccine or right now is right for you. But there's so many positives. I really encourage everybody to get the vaccine. And if you have, like, so if you're a mother, or if you're, currently pregnant, and determining whether or not Pfizer or Moderna is right for you, considering Janssen's currently being under more scrutiny. When we look at platelets, which is part of your circulation, like if you get a cut, it's one of the first things in your body to respond to that site to help clot. So both Pfizer and Moderna are low risk in terms of having platelet issues, which lead to clotting problems. So will we see the Johnson & Johnson vaccine again? I believe that we will. But Moderna and Pfizer are still available. And now teenagers can get it. 16 and up for Pfizer. Moderna is 18 and up, but I suspect that Pfizer is actually going to have the youngest age limit drop down to 12 years old soon. They're currently in clinical trials for young teens, so that age group from 12 to 16, which is part of what I talked about at the beginning of the talk tonight. The clinical trials have 6 months of study between that 12 and 16-year-old age group. So we're not going to see the results of that for quite a while. So that's something we'll have to look forward to. But I suspect that it's going to be available for a wider age range so that we can start to have that protection for more people. And the vaccine is not just about protecting yourself, it's also about limiting the spread, right? It's just a community responsibility to tame the virus. So I want to give Nigel some time to go ahead and talk about his experience as an interpreter within the deaf community and maybe clarify some of the misconceptions that are out there. So Nigel, take it away. Thanks. Yes, thanks, Mike. First of all, I want to apologize for arriving late. With the time difference, I just couldn't get it quite set. And I had 7 o'clock in my mind, but I realized that your 8 o'clock is my 5 o'clock. And so I just had a moment of confusion. Anyway, but as Dr. McKee said, and Dr. Earhart said, there's a lot of women out there, pregnant women especially, who are on the fence about whether or not to get vaccinated. And Dr. Earhart talked about the 3 trimesters, the 3 stages of pregnancy. Our public health officer just announced that it was perfectly safe. Now, in consideration of getting the vaccine or not getting the vaccine is much safer than taking the risk. Because what that's doing, right, as Dr. Harrod mentioned, it's the mRNA. And what that mRNA does is it sparks the body. It says, hey, I need you to get ready, right? It's a training regimen for your body in case any disease were to come in. So in the case of COVID, right, it's ready to fight COVID and to recognize it if it's trying to infiltrate your body. So what that vaccine does is it teaches your body how to recognize it. And she mentioned as well, there's the antibodies that it creates in your system. And that's that army ready to go, that front line of defense. So when COVID is there, they're able to get into high gear to make sure to address the virus in your system. And a lot of research has gone into, if you will get sick, it doesn't like prevent you from getting the virus in your system at all. What it does is it prevents the symptoms and your feeling of sick from being so much worse. And she also mentioned like the umbilical cord, which is what the baby gets all their nutrients from as they grow in the womb. And when the baby is born, the breast milk as well is a good source of antibodies for the baby. So what that does is the umbilical cord gives the child all the nutrients that they need while in the womb as they grow. Blood, antibodies, plasma, all of that stuff comes through the umbilical cord as the baby's growing. And then inside of the breast milk as well. So any disease that all of this can help to protect. So when you get the vaccine, all of those antibodies then transfer to the baby these ways. So because of these excellent pathways that the body uses to protect both mom and baby, it's much safer to get the vaccine, right? And this is a support system for your body as it fends off COVID or any other virus, like the flu. That's what the flu shot does. The flu shot alerts your body to be aware for this virus that can infiltrate it. When it recognizes it, it fights it for you. If you don't get the vaccine, then so much more of the virus can get inside. Your immune system has to work so much harder, and that leads to more complications. So research has shown that all the vaccines available right now are good. Yes, Johnson & Johnson is on hold currently, but typically research for vaccines takes decades for this to kind of reach fruition. But because of the speed of this, there's also much more stringent regulations to ensure the safety before we disseminate the vaccine. The internet's going to go off on its tangents. And so don't look at that for your information. Look at the medical professionals. Look, you've got 2 deaf medical professionals here, experts in their field. Those are the persons you're going to want to get your health information from, not people just posting things on the internet. Because where are they getting their information from? Are they part of the University of Michigan? Because when the University of Michigan is presenting information, the research is there to support it. If people want to share their view online, there's nothing against that. But in talking about where the quality information is coming from, check your sources. And for pregnant women, the vaccine, again, is just going to boost your immune system to be able to work against COVID. And the other thing to consider is variants, because what happens is COVID will change a little bit. And those variants are still protected. Your body's still protected from those variants with these current vaccines. So when COVID's at your door and in the community, it's not able to effectively get into people who have the vaccine. And if there are enough people who have the vaccine, that virus can't get in, can't replicate, and eventually it dissipates, right? And so we have more and more people who are going to be able to get the vaccine, right? We're going to continue to expand our pool. There are researchers all over the globe digging into this, sharing their findings. And what happens is, as they find more information, as it becomes more safe for more people, we're going to expand the pool of people who can get the vaccine, right? And that, of course, there are allergic reactions to consider. Right now, it seems the vaccines cause the first shot, especially some site pain, in the arm, but people aren't dying from this. I mean, it's very, very rare that these serious complications develop in somebody who gets the vaccine. And so as they're finding more and more people are receiving the vaccine and it's working well for them, they're going to continue to expand the pool of people that can get the vaccine. So 18 years old for Moderna, or 16 years old for Moderna, 18 years old for Pfizer. Right in Canada, where I am, AstraZeneca is at 40 years old and older who is able to get the vaccine currently. So hopefully soon they're going to get that. What's different about AstraZeneca and Johnson & Johnson is that it's a single dose vaccine, right? It's just one shot. And again, there shouldn't be this extra resistance to it. It's just something to help your body. Great talk. Thanks, Nigel. So when we're talking about going through, we have the 2 vaccines that are 2 doses. So with Pfizer, you get a second dose 3 weeks later. But after that second dose, you have to wait 2 weeks before you're fully immune. For Moderna, you'll get your first dose. 4 weeks later, you'll get your second dose. And then again, it's a 2-week window after that second dose before you're fully immune. With the Johnson & Johnson single dose, it's still 2 weeks after for your body to develop full immunity. So it's important, sometimes people think that if they get their first shot, even a Moderna or Pfizer, they're like, hey, I'm great, I'm vaccinated. And please pay attention and follow the vaccination schedule so that you are fully vaccinated and your body has all the protection it needs. So we're going to go ahead and turn it over to the audience. So there's been some questions. The first question is related to family and kids. So is it all right to travel once parents have been vaccinated, even though unfortunately there are no vaccinations for kids? So what should you do? I support you traveling, but when you're going somewhere where there's a lot of people, that's a higher risk. So think about camping, where your family unit can be together and enjoy this, or in a cabin, Airbnb, single family occupancy. If you want to go visit family, as long as the other family members have been vaccinated, can you trust them? Are they following good guidelines? Are they taking good precautions? And if they are and you trust that, then that's great. But having all these different households getting together and socializing is really going to be much higher risk. This is a great time to think about getting outdoors, getting back to nature. Outdoors is a much safer travel experience. So if you go someplace, if you try to go to other countries, they actually require proof of the vaccination. So not so much here in America, but like Europe or other countries if you want to go visit. So pay attention to those travel restrictions, because if your kids haven't been vaccinated, even though you have, I'm pretty sure that's still the requirement. So you have to look at where you're traveling to. And also look at the number of cases and whether or not they rise. Unfortunately, here in Michigan, cases are really rising. And once you get there, will you have to isolate? So if there are places you want to visit, you'll have to look at some of the travel restrictions on where you're going. You might fly somewhere and be stuck and not realize it. So just think about all these things and where you might have increased risk. So Dr. Earhart, would you mind taking the next question?
Sure. The second question is it safe for pregnant women or women who want to become pregnant to get the vaccination for the flu or for COVID? And the answer is yes. So both of them, both the flu vaccination is fine anytime during pregnancy. Please go ahead and get it, because it provides a lot of protection against the flu. And now, as I just shared, it seems that so far the research has shown that it's safe to get vaccinated for COVID. So again, please go ahead and sign up for your vaccine, because it will offer protection both for you and for your baby and for your whole family.
Nigel, did you want to add anything there? Clarify from either of our questions? Yeah. So if anyone in our audience here gets the vaccine, whether or not it's Pfizer or Moderna, right? I'm just pick one. That 2-week window that we're talking about, your body is still in training, so to speak, right? It's like building a house, right? You lay a foundation, right? You have to pour the foundation first. You don't just move in, right? You pour the foundation for sure. But once the foundation's set, then you add the walls. You start to frame the roof. Exactly. It's the same idea with a vaccination, right? Once that first vaccination goes in, that's building the foundation. Then you have that 2-week window. Once you get to like 2 weeks, 3 weeks, 4 weeks after, for us, it's like 4 months sometimes before you get the second shot. So you follow your state guidelines wherever you are. So it's 3 weeks, 4 weeks, whenever it is that your time schedule is to get the second dose. That's building the walls, framing the roof. And what we're doing is that's building on that foundation, that solid foundation of the first vaccine, the first dose. And so that's completing your house. And once your house is complete, then you get to move in. Same idea with the vaccination. Once your body is completely trained, has done all of the framing that needs to do, it's ready. So when the virus, your body is fighting the virus, it's nothing. It's just a little event. So thinking about it's important to still stay as contained as possible with your family unit. If you want to expand your pod by including a couple of other people, make sure, again, that you continue to see the same group of people, as opposed to everybody sees different people, because what you're doing is you're seeing all the people that they've seen, essentially, when you get together. So stay with the same pod until your state public health officer gives the all clear or changes the regulations. As long as the public health officer is saying that there is still some concern, follow that concern. Don't socialize in large groups, right? It's important to, as your unit goes places, maybe you go travel, like Dr. McKee was saying, but you go somewhere where there's no hospital. Be careful. Pack all the food that you need from home and bring that with you camping or to the cabin, right, to your campsite. That way you don't have to go grocery shopping in an unfamiliar environment where COVID might be around, right? And then of course, clean everything up. Don't leave anything there where on your campsite, be respectful. Where I am in British Columbia, we're still on a travel ban. The local authority, we have 5 different provinces, and so you have to stay within your local province. So Vancouver Island and the city of Vancouver, you can't go across the channel to visit, and for good reason as well. You could, even if it's by boat or by plane, they want to keep all of these different provinces separate. And so the important thing is to think of is common sense, right? Once you get vaccinated, it's not gone. You are more protected, but you have to think about the people around you, whether or not they're at risk of giving it to you or they're at risk of getting it. And so wait for your public health officer to give the all clear.
I also wanted to expand on, once you get the vaccination, it still means you need to wear your mask. You still need to protect yourself.
Absolutely.
You still need to social distance. And that's because you still might be able to spread it. We're still not sure. So even though you've been vaccinated, please keep wearing your mask, keep social distancing.
Oh, yeah. So just to reiterate, the vaccination is also not a 100%. It is very effective. It's the best tool that we have right now in fighting this. But it is important for everyone to remember it is not 100% effective. Both Pfizer and Moderna, it's like 1 in 20 still get sick. So it's important to be as safe as possible, follow the masking and distancing precautions. The next question is like traveling by plane. What's interesting about a plane is that they filter their air. It's almost a lot like an operating room. So masking, distancing while sitting on the plane, hand washing, you should be okay while traveling on a plane. They are not distancing in their seating as much as they were in the past. I've noticed they're sitting people closer together again, so that's interesting. But within the cabin, the airflow is really well filtered. So there's a lower risk of infection from that. But whether or not you want to travel through plane or wherever, consider what you're traveling for. A family emergency, obviously. But if it's just like you want to go out and do something, you're going to go on vacation, this may not be the best time to do that. Again, consider your level of acceptable risk. Anybody else want to add anything on that? No? Okay. So another question is, will there be a 4th, 5th, 6th wave? Well, just looking at Michigan, unfortunately, we are in a 4th wave. We are really struggling as a hospital with the number of people that we are admitting. So things are not doing well here. Across the US, seems that actually some places are still experiencing COVID spread. But as the warm weather comes around and lots of people are getting out more, the numbers aren't as bad in other areas. So hopefully, again, getting out, the warm weather is going to cause the COVID cases to fall. Looking to fall and winter of this year, it will really depend how many people got the vaccine. Have we reached what we've known as herd immunity, which is enough people in the community vaccinated? And like Nigel was saying, the virus is going to try to look for an easy target, someone who doesn't have the vaccine. And if enough people have gotten the vaccine and the virus can't infect anybody, it will essentially die. So with herd immunity, we need a minimum of 75%. Sometimes it's give or take, but that's our target in terms of vaccination for immunity. So even though we think it's enough, the virus can still spread because COVID is changing. There are different variants, and so if there's a variant that is too new, that we haven't seen before, that could be a risk. But again, these vaccines are providing some relief for us in terms of protection. So follow the recommendations in terms of once we have enough people who are vaccinated, we'll see how it goes though. Anything else anybody wants to add? Yeah, Nigel. So let's take a look at the big picture. Let's compare it to sheep, okay? You have a pasture of sheep. All the sheep are white, fluffy, woolly flock of sheep. And then we've got one black. That one doesn't have the vaccine, right? Everybody else in this flock has been vaccinated. So the virus is going to look for the black sheep because all these other white fluffy sheep have been vaccinated. But they see the black sheep way in the distance. As it tries to get way out there, it's going to fail. It's going to die. That's that protection for the flock because enough of the flock have had it. And then I see this attitude sometimes about masks. I mean, if you look at hospital situations are the worst, you have to think about the health of yourself, but also the health of those around you. Just wearing a mask, I mean, we shouldn't have to twist your arm. We're not twisting your arm. We're not asking you to permanently secure it to your face, right? You can take it on and take it off as you need to. There's another thing I wanted to mention though. In terms of the waves. We're still kind of anticipating there's a little bit of a rise. We're looking to maybe our third wave. But what's interesting is that older people are dying less, are being admitted to the hospital less, because vaccine distribution here where we are started with the eldest. And as enough of those people were vaccinated, we can continue to lower the age. There are some emergency service personnel that have also been able to get in there in the vaccine scheduling. And it's not like there are zero deaths or zero hospitalization. That's not true. But we are much better than we were last year. And again, it goes back to my analogy about the flock of sheep. If we have enough people that, I don't know, for whatever health reasons or whatever are still susceptible, it's still going to spread. So we have somewhere between 50s and 60s or 40s, people who are 40s. I'm not sure what it looks like in the States for you guys, but still going to the hospital, even because they're the ones who haven't been able to get vaccinated where we are. So still important to follow common sense. Even if you've been vaccinated, distancing, mask wearing, hand washing, hand sanitizing. These are all the tools that we need. Follow the health department. They're making decisions that are best for our communities. They're the ones who know. They're doing all the research. I don't have that kind of knowledge. I don't have the experience that they do. I don't have access to that information. They're the experts. So they're the ones we want to follow. Yeah, that's really great advice. In Michigan, we have about 29% of the people vaccinated, right? So we have immunity for those 29%. But in terms of protection for the others, COVID is still being able to find pockets of communities and people where they can, spread, for where COVID can spread. Next question a person asked. I'm sorry, the interpreter missed that one. If there's a serious reaction, will you know if it's safe or not? So I just want to be clear. If you're talking about once you get the vaccine or if you get sick. In terms of the spleen. So with antibodies, I would recommend that if in that situation, if you have no spleen, it's really important to sit down with your family doctor and look at the options. Could you get sicker from the vaccine? Could you get sicker without the vaccine? Get a flu shot and COVID vaccine are very different. So they're not vaccines that you can really compare. Do what's best, do what's safest, look at your health options, look at your health history, come up with a plan and see if your your doctor can give you better tips on that. Okay, the next one says COVID spreads it's a respiratory virus, not through signing. So does COVID spread less in signing communities because they're not talking as much? Or does that mean it's a lower risk? Well, no, because people are still breathing, right? So breathing is enough. That's enough to spread the virus. Talking, singing, yelling, of course, obviously the virus is probably going to spread a little bit further, a little bit faster, but you're still breathing. So no, that's not like less risk. Even there in fact, lots of deaf people who have gotten sick and unfortunately in our deaf community have died thinking this. I know we have just a few minutes left. So let's see if there's any other questions. Oh, turns out looks like there's one more. Question about mask requirement. What's your best recommendations? So the CDC just announced that once you've been vaccinated, you've had both doses or with your Johnson & Johnson full dose, right? When you're fully immune based on your vaccination, you can take your mask off when it's safe, not when you're in a crowded environment. But like if you're in a store, because I know some states are starting to get a little bit lax and leaving it up to the individual to decide. I'm not so sure about that. In my opinion, that's still not safe. It's important to respect other people in the community. You don't know who has an immune deficiency, who would be more susceptible. You don't know who's around you and whether or not they're at a higher risk of death. So really, other people's health are our responsibility. Wearing a mask is such a simple act. It's not a big deal at all. I know people are getting tired of it. I know we're getting fed up with all the restrictions, but it is important to protect each other. And it's such an easy thing to do, to wear a mask. So I recommend still wearing a mask. Nigel, did you want to add something? Again, I just want to reinforce, like, okay, let's say you have a politician and you have a medical professional. Who has the experience in health? Who has all the knowledge? The medical professional. They're the ones who have done all the research. They have the years of experience. They have the university credentials. A politician doesn't know anything about that. They know how to flush the toilet. I'll give them that much. The point is, listen to the experts. Listen to who has the information, the doctors, the nurses, that professional community. A carpenter is the expert in building a house. They're experts in their fields for a reason. Politicians have lots of things to say, but they don't know. They just want your vote, right? And I'm neutral. I'm from Canada, so I don't even have an influence in your American political system. States all over are concerned, but one of the things that we can do is wear a mask. Because what this does is it prevents COVID from spreading. It also lessens the variants, because a lot of these variants spread so much more quickly. So go back to that house analogy, right? We have, if you're in a house with a lot of people, right, it starts to get humid and you've seen the windows fog up because of that. Don't do that. That's all that breathing inside. Get outside, socially distance, wear a mask, gather in small numbers. And if you are together inside, make sure there's good ventilation, that the AC works well, that there's good exterior exhaust. Health professionals know what to do. They will deliver the guidelines when the appropriate time is. Politicians are great. They do what they do, but no, thank you. They're not the health experts. All right, it's time to close. We're getting closer to the end. But again, I want to thank everyone for joining tonight. Thank you both for your time, for your experience, and for your expertise, for sharing. Next month is going to be mental health, because it's Mental Health Awareness Month. So we're going to talk about mental health strategies for managing symptom, just managing your mental health, during this pandemic as well. Also, I want to thank all of our partners for supporting our Deaf Health Talks and making them a reality. So if you're looking, we're also looking for more moms to take our survey. So if you know somebody who's a deaf mom, hard of hearing mom, please invite them to fill out the survey. Thank you, Christine and James, our interpreters. Thank you, our Kate, for captioning. And thank you, everybody, for coming tonight. Thank you.
Thank you so much.
Good luck, everybody. Take care. We'll do that. Yes, please stay safe.
Bye.
Good night.